How quickly can you get back on the football pitch after ACL reconstructive surgery? Hi, I'm John Walczak, orthopaedic surgeon at Shirley Oaks Hospital, part of Circle Health Group. Today, I'll be talking about how quickly you can play football again after injuring your anterior cruciate ligament, also known as your ACL. ACL injury is common amongst footballers at all levels, whether you play professionally or as a hobby. In fact, ACL injuries account for 50% or more of all knee injuries. Although it can be a challenging injury for young athletes, it is possible to return to sport such as football following reconstructive surgery. First things first, what is ACL reconstructive surgery? ACL reconstructive surgery involves reconstructing your anterior cruciate ligament. The ACL is a tough band of tissue in your knee joint that joins your thigh bone to your shin bone. It runs diagonally through the inside of your knee, helping to control the back and forth movement of your lower leg. ACL injuries usually happen when playing sports such as football, rugby or tennis. They happen if your lower leg extends forwards too much, or if your knee and lower leg are twisted while your foot remains planted on the ground. You'll have a general anaesthetic for the surgery, which means you'll be unconscious during it. The operation will usually take about 60 to 90 minutes. Your consultant will begin by making one or more small incisions on the front and sides of the knee. Through these, they'll insert specifically designed surgical tools. They're used to remove the damaged ligament and replace it with a segment of your own hamstring tendon. Your surgeon will drill sockets in the thigh bone and shin bone to accurately position the hamstring tendon graft, which is fixed to your bone with special screws. The graft will serve as a surface on which new ligament tissue can grow. Your consultant will close the wound with stitches or clips. If the stitches are dissolvable, they'll disappear around about 3 weeks. What is the recovery process like for ACL reconstructive surgery? Your knee will be very swollen immediately after surgery. The first part of rehabilitation will be to reduce the swelling as quickly as possible. This can be done with ice and special ice-filled compression sleeves, as well as anti-inflammatory tablets. It's vitally important to get your knee moving as soon as possible to regain strength and balance. Within 2 to 6 weeks, the swelling around your knee will go down. However, the tissue graft inserted during surgery is usually weak round about this time, meaning the ligament may only be able to handle light exercise, such as extending your knee and walking. Cardio workouts on a stationary bike or swift walking can be an excellent way to help regain fitness levels in the early stages of recovery. You should be able to walk unassisted without crutches after 2 to 3 weeks. A few months on from your surgery, your knee will be stronger and able to handle much more pressure. Of course, you'll have regular physiotherapy appointments throughout your recovery. Our physiotherapists recommend running after 12 weeks if your pain is 2 or less out of 10. When your injured leg is less than 10% weaker than your healthy leg, you can then go back to unrestricted activity. During the recovery phase, pain does not necessarily mean re-injury. It can often be due to muscle inactivity or malfunction that improves over time. I recommend exercising through pain unless it's more than 5 out of 10. You can usually start jumping when playing football after 4 to 5 months. When can I get back to football? The big question. Your physiotherapist will want to make sure you don't feel pain in your knee when you run and there is no swelling before you get back on the pitch. You'll be most likely cleared to play when you have an acceptable range of motion with good stability and when your injured knee is as strong as your other knee. Your recovery period from around 3 to 6 months after surgery is about getting you back to full strength, but the pace needs to be set by you. Many footballers will feel able to start playing again at this point, but your physiotherapist may want to make sure you pass further functional tests before giving you the go-ahead. What happens if I play too soon after surgery? It's important you only return to sport when your body is completely ready. You could risk re-tearing your ACL if you put too much pressure on your knee before it's ready. For many people, there are risks involved in returning to football less than 12 months after surgery. You do not want to face another injury. The precise length of time it takes to recover varies between individuals. It's important to make sure you feel ready to start playing again. We understand it's hard not playing your favourite sport, but the more closely you follow your recovery programme, the sooner you'll be back playing. So there you have it, a run through of ACL reconstructive surgery and how quickly you can play football again. If you'd like to discuss this surgery in more detail, you can book an appointment with me or your nearest consultant at circlehealthgroup.co.uk. We hope you found this video useful and don't hesitate to leave any questions in the comments section below.